Good morning. Can you hear me okay?
Hi there. Yep, I'm just getting myself set up here. Good morning.
No problem. Good morning. So it's what time is it for you?
It's 7.
7. Oh, thank you so much for being willing to do this early.
Oh, it's my pleasure. All right.
Yeah. Perfect.
Get up here. The sun is not up yet, so I'm playing around with this light here.
Totally understand. Take your time.
Okay, 1 second.
No problem.
Okay, and I can share my screen.
Okay, great. Great. I see that perfectly.
Okay, awesome.
And let me, 1 second. Just trying to find. Okay, so I put together just a quick intro.
Okay.
For you, for the presentation, the session in general. So I see yours. Everything looks great. I'm gonna.
Do you need to share your screen first?
Yes.
Okay.
Yes. So I will be doing that.
Okay.
And let's see. Share mine. Okay, so I have one slide to introduce you and just wanted to make sure that you were fine with how I worded it and happy to change it for you. Just want to make sure people know that we have the breakout rooms.
Okay.
And I could also add, that there'll be polls, but I know you'll be sharing that. So
I decided not to do poll because I think I'll run out of time. Yeah.
Okay, got it. All right, so this is what I have for you.
Okay, beautiful. That looks great.
Okay, I pulled that information from your bio, but happy to emphasize anything you would prefer.
That looks great. That's good.
Excellent. Okay, great. So we'll be good on that. I'm going to just leave it at the beginning.
Bless you.
Gotcha.
You can come in here.
So then for, I know you're going to be sharing some resources. I'm assuming some from the Ccva website.
Yep. So it's the 3 links that I sent you on Friday.
Okay, perfect.
Yeah.
So I'll put those in as appropriate.
Okay.
I'll probably send them several times because with Zoom, you can't pin, information to the top of the chat. So I'll put it through. And then because we're just in the meeting option for Zoom instead of the webinar, we don't have a separate Q&A. It's just the chat.
Okay, no problem.
And that's,
the resources that I sent you, so I sent you 3, and I'll just tell you the order that so the competencies are the first one that I'm going to say. Do you want me to just say, kind of say, Jovita, can you put that in the chat so people can see it?
Yes, that would be great. Let me go to that email. I'll make sure I have them up on my.
Chaim, are you awake? Okay, are you okay?
Is that little one?
Yeah, just waking up for school.
Okay. All right. So body of knowledge and competencies will be first.
Yep. And then the second one is going to be the self-assessment.
Okay.
And then the last one is going to be the ethics.
Oh, perfect. Okay. So in that order.
Yeah. And
All right, great.
the self-assessment, I'm going to get people to go actually do it, like quickly go through it and do it.
Oh, great. Great.
As part of it. So.
Okay, perfect. Okay, well, I think we're good. The breakout rooms, would you like 3 to 4 people in each room? What's the number you would prefer?
Yeah, maybe 5 or 6 in each room.
Okay.
Yeah, and then I'll just get them to, they're just going to introduce themselves to each other, just real, yeah, and it'll just be like 5 minutes, a breakout room.
Okay.
Yeah.
6 people. All right, I will take care of that. And then if you just want to mention the amount of time.
Just twice, yeah.
Okay.
Yeah.
So 5 minutes each about, okay, great. And they'll just be the 2 times later in the presentation.
They're just at the beginning. So it's going to be slides 5 and 13. Okay. Yeah. Great.
Okay, perfect. I think that is everything to get us started.
And I think you had said that when we're not in breakout rooms, it's in meeting mode. So we don't, everyone's cameras off and it's just me and the screen in the chat.
Correct, correct. I will pin you. Hold on 1 second. I'm so sorry.
No problem. I'll be back in a second too.
Okay, no problem. Yes, please. All right, thanks. Yeah, no, thank you. No. But I had to change it back to meeting the webinar, so you'll be doing the admitting. I think there's admit all.
I say if like more than one person comes in.
Got it. Okay.
Can you invite me?
Yes.
So you're leaving right after this?
Yeah, ideally.
Did you get a rental car already?
It was 45 minutes. I was there at 7:30 and by 8:15 somebody came in, they vacuumed real quick and then turned it around. They were like, we're waiting for cars from the airport.
Did you go to the airport or were you in South?
I was on South Monroe, which is just, it's like a prison over there. And it's just so close to my house, but it's not worth it anymore. Yeah. So Avis is over there? Okay.
It's like September, I think.
Okay, perfect. I didn't realize that. Okay, great. So love to introduce FISA. She's the Executive Director of the Council for Certification in Volunteer Administration, which is an international organization, and I'm sure she'll share more with you about it. She has 20 years of leadership experience specifically in volunteer engagement, and within this particular position that she has, and also just in general over the course of the work that she's done, she really works to develop community within the profession, which we know is so important for us to network and be able to rely on, share best practices with one another, improve equity and access to volunteerism, as well as increase diversity among professional leaders of volunteers. So I am going to have FISA go ahead and share her screen. I'm going to get out of mine. We'll spotlight her and we will go ahead and get going. Good morning, FISA.
Good morning, Jovita. Can you hear me?
Yes, very well.
Well, good morning, everyone. It's so wonderful to be here with you this morning. I am joining you from Temecula, California, which is the traditional lands of the Payom Kicham people. In the Louisiano language, that means the people of the West. My name is Fiza Vincent. I am a CVA, and I see a few CVAs are also here as well. So hello to you. CVA stands for Certified in Volunteer Engagement. We have just over an hour together today. And so what I wanted to say, first of all, before we get started is, if you have questions for me after this presentation or things that you're thinking about, mulling over, please feel free at any time to get in touch with me about anything that we talk about today. We're going to be talking about 2 specific resources that are available for leaders of volunteers. And this morning is not enough time to dive deeply and understand them if it's the first time that you are looking at these resources. So please, if you've got questions about them after today, my virtual door is open. You have my email address on the screen right now. You also have our CVA website, and I would be happy to chat with anyone going forward. All right. So today we are going to talk about, let me just get my screen going here, 1 second. So we're going to talk about 3 things today. What is the CCVA, the Council for Certification in Volunteer Administration? I'll just give you a brief introduction of what it is that we do so you can understand the 2 resources that I'm going to share. Sort of, we house them and why do we house them and what are they for? We're going to be talking about the body of knowledge and competencies and professional ethics in volunteer administration. All right, so CCVA, the Council for Certification in Volunteer Administration, we are a proud member of the Institute for Credentialing Excellence. Our vision is a world where competent, passionate leaders effectively engage volunteers, very similar to what Volunteer Florida believes, and both of our organizations are really invested in you as leaders of volunteers and doing what we can to support you in your work, build capacity in the work that you're doing in engaging communities. Our mission is to advance excellence in volunteer administration by delivering professional certification and advocating ethical practice. So just a really brief history of CCVA. In the early 1980s, the first competency-based international certification was developed by AVA, the Association for Volunteer Administration, and it was called the Cva, and that stands for Certified in Volunteer Administration. In the year 2000, there was a revision to update the competencies to align with national certification standards. And that's where we are really proud of our membership with the Institute for Credentialing Excellence. Our credential is on par with thousands of other credentials that other professionals in different industries also achieve and strive towards maintaining as well. AVA dissolved in 2006, and CCVA was born and was established as the new home for the CVA credential and the professional ethics material, which we're going to dive into today as well. In 2015, just 6 years ago, a new body of knowledge and competency framework was created for the exam. And what I wanted to mention for today is that the 2 tools that we're going to be going over are applicable in any industry where you lead volunteers. It could be disaster management, healthcare, childcare, working in the environment, fundraising, anything, health and fitness, employment, volunteer centers, anything, any sort of industry that you're working in, these tools can apply wherever you're working. And what we really have seen over the last 2 years is that they can also be applied in any context. They're pretty universal. And so if there's a pandemic, they don't need to be modified or adjusted. They're applicable in a pandemic. If your organization is doing some justice, equity, diversity, and inclusion work, all of these tools can also be used for that work as well. So they're very universal throughout all industries, and they're also universal throughout different contexts as well. We have CVAs from all over the world, and so they're also, you're able to also apply these resources wherever you are in the world as well. And that's really important to understand in terms of the credibility of these resources as you move forward. So really quickly before we get started, I'm sure that some of you know each other and some of you may not, but I'd love for you to get into the breakout rooms, and Jovita will get us started with those when I say go. And really quickly, you'll have about 5 minutes and about 5 to 6 of you in a breakout room. Say hello and good morning to each other. I'd love you to introduce yourself and where it is that you lead volunteers. And then lastly, what unique value does your position add to your community or your organization's mission? So you specifically as the leader of volunteers in your organization, what unique value does your position add to your community and your organization's mission? Don't have to belabor it, just real quick, a minute each. So Jovita, if you want to put everyone into breakout rooms, I will see you back here in 5 minutes. Right, Jovita, I'll just wait to hear from you if everyone is back from the breakout rooms.
All right, we are good to go, Fiza.
Wonderful. Well, I had a great time meeting a few individuals in my breakout room, and I hope that you did too. So the reason that I asked the last question, what unique value does your position add to your community's organization and mission, is because you'll get a diverse, you'll get a diverse response of reactions and ways in which people communicate what it is that they do. And this is why it's really important, and why I want to share with you the body of competencies, the body of knowledge and competencies from the CCVA. So what is a competency? So a competency is an observable ability, skill, knowledge, motivations, or traits that are defined in terms of behaviors needed for a successful job performance. So this is beyond you saying, sort of what the mission of the organization is. This is beyond talking about, I engage X amount of volunteers and they gift our community X amount of hours. This is not about how likable you are. This is really about the observable ability, skills, and knowledges that you have that make you successful as a leader of volunteers. So let's dive right in. The body of knowledge and competencies are made up of 7 unique competencies. Now, these competencies are specific to leaders of volunteers. It's a pretty impressive document, the body of knowledge and competencies, because it conveys the vast scope and the complexity of the roles that we have. Jovita, if you wouldn't mind just sharing, if you haven't already, the link in the chat so that people can take a look at the body of knowledge and competencies, I would say save this, and when you have some time down the road, take some time to look through the body of knowledge and competencies to see basically all of the things that leaders of volunteers are doing. Now, these are the tasks that are unique to our field of work. So even though in your organization, there may be other staff who also partner with volunteers, there are other staff that may work side by side with volunteers. These are the competencies that are unique to leaders of volunteers. And this is why things like, ethical decision making, or, using technology or database management, those are not unique to our field, and those wouldn't be included here. So obviously in your role and in your job, there are so many things that you do, but these are the ones that are specific to you. So I want to take a closer look as what does all of this mean. So the 7 competencies are planning for strategic volunteer engagement, advocating for volunteer involvement, attracting and onboarding a volunteer workforce, preparing volunteers for their roles, documenting their involvement, managing performance and impact, and then the whole piece around recognition, acknowledging, celebrating, sustaining volunteer involvement. Now, each of these 7 competencies are then broken down into 67 different tasks. So it seems like a lot, but that's what you do every day, and that's what we do as leaders of volunteers. So let's take a closer look. We'll start with the first one, planning for strategic volunteer engagement. And I'll give you an idea of what I mean when I say that each of the competencies is then broken down into a further task. So if we look at planning for strategic volunteer involvement, there are 10 tasks that then support that competency. So, one would be assessing organizational needs and opportunities for volunteers. So if you're sort of the person in your organization that helps to plan, where will we be involving volunteers? What opportunities do we have for volunteers? That is one of the tasks that supports this competency. Promoting organizational readiness, is the commitment there from our senior leadership? Do we have the resources? Do we have the capacity? Do we have competence amongst our staff and other volunteer leaders? Researching and analyzing related programs and services. You're doing that right now with your colleagues all around Florida, and joining together to talk about related programs and services. And you'll do a bit of that sharing today. Developing goals and objectives for your volunteer services. Sometimes this is in your purview and sometimes it's your supervisor or senior leadership that does this. But hey, you've got a body of knowledge and competencies. And so if this is not something that you're doing, put your hand up and say, like, I'd love to develop the goals and objectives for my program and for volunteer services. In my profession, that is part of the competencies that I need to be responsible for. Take that and put that onto your plate. And so you have a little bit more control and input into something like that. Developing policies and procedures for volunteer services, supporting tools and resources like forms, the databases, an evaluation plan, risk management plan, benchmarks, and then and implementing all of those things as well. So when you think about just that one competency and planning for strategic volunteer involvement, the 10 different tasks that are involved in it, you can see how the full body of knowledge with all 7 competencies and the 67 tasks that make those up really show the breadth and the depth of what we all do as leaders of volunteers. What I wanted to talk about also is that there's enabling knowledge that we have to possess to be effective and relevant leaders of volunteers. And there's also enabling skills. And so the body of knowledge and competencies also talk about that. So not only are there the competencies that are unique to the work that what we do, but there is enabling knowledge. And I'll explain what that means. So enabling knowledge that helps us to do this work effectively. And that helps us to partner with the rest of the staff and volunteers in our organization and to integrate efficiently as well. And so these are the things that are not unique to our role, but these are 23 knowledge areas that were identified when the body of knowledge and competencies were developed. So I won't read them all out, but these are also listed on the screen. And so, for example, understanding the human resource laws in your state, sometimes even in your local region and your municipality is really important. Stuff like this, really came to play during the pandemic. Where I lived, my city had certain restrictions in place, but my province at the time had different restrictions in place. Now I've only been living in California for about 6 weeks, but my city does one thing, my county does another thing, and then my state does another thing. And so being well-versed and knowledgeable about that, especially when you might be leading volunteers across a broad geographic area, is really helpful. So it's not unique to what we do, but it's the knowledge that enables the work that we do. There's also enabling skills. And so these are the skill areas. There's 11 that were identified. And these are the skills that are needed to do the 67 tasks of the 7 competencies well. And so all of us, use these skills daily. And oftentimes when we talk about what we do, we talk about our skills. We resolve conflict, we motivate other people, we facilitate training, we tell people, we recruit volunteers, and then we place them. Those are the skills that we have, but the competencies are unique to what we do, and those are observable. So when you're talking about your work, especially when you're trying to gain traction in your organization, perhaps you are trying to bring light to the work that you do, you're trying to bring light to the work that volunteers do. The enabling skills that you have are wonderful, but what you really want to talk about are those competencies and the tasks that you bring to the table in your position that are unique and separate from what anybody else is doing as well. All right. So why is all of this important? It's so important to work the competencies in your favor. So when you look at a position description for a leader of volunteers, even if you're looking at staff that you want to engage in your organization who are going to partner with volunteers, these competencies are so important because, as I said, they're unique to what we do. So even though, somebody in your program department partners with volunteers and has those enabling skills, you also want to know, do they have the competencies to partner with volunteers? Those that are unique to people who partner with volunteers and who lead volunteers. So you want to use these competencies, for example, in position descriptions for your role, for anybody that's on your staff team, or even for staff partners. And so here's how I work the competencies. I just left a role at the YMCA of Greater Toronto where I was for 10 years. And in every single position description at the YMCA of Greater Toronto, whether you're in accounting, whether you're in maintenance, you might be a lifeguard, you might be a childcare educator, every single position description had something in there about the expectation for staff to partner with volunteers. If you want to say that your organization is led by volunteers, we couldn't do it without volunteers. It should be an expectation for all staff. And so one of the ways to work those competencies is to talk about the competencies of your entire staff team, all the way from your CEO and your executive director, all the way to your frontline staff. And so you can use those, and you can, encourage in your HR team, your senior leadership. If you're not on the senior leadership team, whoever is the person that is, talking about how do we really, walk the talk and be a volunteer involved organization. The competencies also provide you with concrete language about the value of your role and the skills and abilities and knowledge that is required. You're not just the nice person in the organization, it's not just about the number of volunteers, the volunteer hours. You have extreme and important value in the work that you do that is unique. That's why we have our own set of 7 competencies. So you have that concrete language. And, once you're really well versed in what all of the competencies are, you be talking about that, be talking about what you bring to the table, be talking about what is unique about what your role, why you need to be included in conversations you might not be included in, or why you need to lead pieces of the work of an organization where you might not be. A really good example of that, I heard a lot of frustration over the last year from leaders of volunteers who weren't included in plans for reopening their locations or bringing volunteers back if they had taken a pause because of COVID. Your value and your skills, you should be somebody that is included in those conversations and not just reacting to those decisions made by your senior leadership or by your organization. And you've got the concrete language in the competencies to be able to say why it should be you that's included and why it should be you that is helping to make those decisions. The body of knowledge and competencies are also really helpful in performance planning and management. So if you are in an organization where you have an annual performance review, or you have goals and tasks and things that you need to meet, use the competencies. Some people that I know, actually their performance planning is 7 sections. So it's 1 section per competency, and they have goals and things that they need to achieve in each of those competencies. And it really illustrates to your supervisor or to your senior leadership what it is that you do and why it is that you're a valuable asset to your organization. And nobody else is going to have those on their performance review. Nobody else is going to have those competencies. The competencies are also very useful for your personal and your professional development. So I'll tell you, for myself, I was working in volunteer engagement for 15 years before I decided to go and get my Cva to be certified in volunteer administration. And I was kicking myself when I finally went to do it, because all of a sudden there was all of this language and all of the competencies that really helped me to communicate what it is that I did for my organization, what value I brought to my organization. And then I used that for my own personal and professional development. So I went through the different competencies. I looked at the areas that I had good experience in. I looked at the areas that I had great experience in, and then I looked at the areas where I had very little, and I spent some time focusing on those areas and learning a little bit more about those areas. Also, after having been in the sector for a really long time, there were some tasks like onboarding, for example, that I hadn't done in a very long time because I had moved more into a strategic role. And so I needed to go back and really understand what had changed in my field, what was different, what tools that were we using that were different when it came to onboarding, so that I could better support the teams that I worked with and the staff that I supported that were partnering with volunteers. So it's a great guide In terms of your professional development, people often say, I've been doing this for a really long time. Like, how do I stay engaged, or how do I keep my skills up to date? Looking at those 7 competencies and then, knocking them out and sort of saying, like, here's where I'm excellent, good, great, and excellent is a great way to track your progress. The competencies are an excellent tool to negotiate a salary. When you're looking for a brand new job, for example, oftentimes an organization may not have the understanding of the full scope of what it is that you do. And I have been so bold as to say, are you also expecting me, and I, in my mind, run through the competencies, are you also expecting me to help you plan for the strategic engagement of volunteerism, which is not anywhere on the job description? Well, great. If you're expecting me to have a role in strategy, and if that involves me working with senior leadership, then I want to negotiate a title change, or I want to negotiate that I'm part of senior leadership, or I want to negotiate more of a salary because your current job description doesn't talk about that. So being able to have that language and to ask, are you expecting me to do this, 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 and this really helps. Some people work in organizations where there are more resources, and you could be a leader of volunteers who only does recruitment. You could be somebody who only does training. And so that's helpful for you too, in sort of knowing what is in your scope and what it is that you do. But use these tools, use them to negotiate a new salary, a rate, or benefits when you're applying for a new role. If you are at a point in your annual performance where you're talking about a raise, or if your job has changed, which for many of us it has, very much so in the last couple of years, we've had to rethink how we do training. We've had to all of a sudden shift and do things virtually. Use those tools to negotiate your value and your worth as well. And don't be afraid to ask for those things. But, instead of just asking for them, demonstrate why you feel your position has changed, or why you feel your current position description doesn't reflect everything that you do. And you've got the competencies there, 7 of them, you've got the 67 tasks to say, like, these are all of the things that I do. You've got the language right there for you. All right, so we have an amazing tool that you can use. And Jovita, I'm going to ask if you can put the Cva self-assessment tool in the chat. What I'd like you to do is to click on the link that Jovita is sharing with you in the chat right now. This is the Cva self-assessment tool. If you are somebody that is going to be applying to become a Cva, this is one of the first tools that we ask you to use. It is intended to provide guidance when studying for the Cva exam, but it's actually a tool that you can use at any time. It is there to assess your own level of knowledge and experience in each topic area, and then you can identify the areas that might require further study or review. And so for the purposes of today, it's identifying the areas where we feel we have good, great, or excellent knowledge. So what you'll see on the Cva assessment tool, the green boxes where everything is lettered are the 7 competencies. And then under them with the numbers 1 to 67 are all of the different tasks that support the competencies. So what I would love you to do is to take a few minutes, let's say, just look at my clock here. So it's 11:12 right now for you. And what I would say is just take a few minutes, and you can turn your cameras off or mute for a second. I'd love for you to go through as many of the different tasks as possible, and give yourself a 1, a 2, or a 3. Do I have minimal or no knowledge or experience? Do I have some knowledge or experience? Or do I know and understand with solid experience this task? So for example, assessing organizational needs and opportunities for volunteers. Do I have minimal or no knowledge? If so, I would give myself a check mark in the 1. If that is something that I do, if I'm in a strategic position and I'm the person that is always determining what our organization needs and what potential volunteer opportunities are we going to maintain, or what new ones are we going to bring on, I might give myself a 3. If I'm not sure and I do a little bit of both, I might give myself a 2. So what I'd love for you to do is click on the link in the chat box, look at that, and take a second to go through and see where you would be giving yourselves a 1 or 2 and a 3. I'll give you a few minutes to do that. And then we will share with each other sort of, where we found ourselves in going through this exercise. All of the resources that I'm sharing with you today are on the resources section of our website, cvacert.org. And Jovita will share them with you too after today's session. We'll do this for about 2 more minutes. Any questions, just let me know in the chat. And I apologize, I didn't provide a fillable PDF. I will update that on our website. And Jovita, I'll send you that too, so you can send that out to people. All right, so you might not have had time to get through all 67 tasks, but if you got a start at this, that's excellent. What I would love for us to do then is we're going to get into another quick set of breakout rooms. And what I'm going to ask you to share is, what's the self-assessment process like for you? Is that difficult to read those tasks and to figure out if you're a 1 or a 2 or a 3? Are there areas where you recorded a 3 with, utmost confidence, and are there areas where you recorded a 2 or a 1 where you wish you had more experience, or where you didn't have any? And what I would say is, if there are areas where you recorded or a 2 or a 1, this is an opportunity for development. And this is a place where you can, on a performance management process, or somewhere where you can say, here's an area where I want to be more involved, or here's an area where I'd like to have more input, or here's an area that I think should be part of my responsibilities. And so I'd like to find out a little bit more, or here's an area where I need more training and development. And so I need our organization to put some resources behind that. I need to attend X conference, or I need to be able to go to a course or read a book or, do some work in this area. So you're going to be popped into some breakout rooms and just say hi to each other and just talk about what's the process like. Are there areas where you gave yourself a 3 with confidence? And if there are, share that with each other, because you can look to each other as experts. If someone has a 3 in an area and someone has a 1, love connection, you've made a great match. And you can support each other and work with each other and helping each other build those skills. And are there areas where you recorded a 2 or a 1? Why and what can you do about that? All right, so we'll put you into your breakout rooms real quick and we'll see you in 5 minutes. Think about images, like would I be comfortable seeing this decision announced in the newspaper or on Facebook? If I made this decision and it was plastered, if my spouse heard about it, would I be comfortable with it? Is this decision going to hurt or harm our public image? Culture, does this decision support or damage our organization's culture and values? Sometimes we have to put that into consideration. And the last one, which sometimes we get stuck on and it's hard to get out of, and I encourage you to try to push it to the end of your decision making, is that knot. Sometimes there is that knot in your stomach on a gut level, emotionally. You think to myself, like, if I make this decision, what will my parents think? What will my children think? What will my neighbor think of me if they knew that I did this? All right. I want to take you through really quickly how we apply the ethics. I want to talk to you about Jasmine. Jasmine is the director of volunteer services at a hospital. She's been asked by senior management to organize a COVID-19 vaccination clinic for hospital volunteers based on her government's current phasing criteria, and vaccination supply is not guaranteed. While determining which volunteers meet the current age and medical criteria, Jasmine is approached by the Vice President of Development, who instructs her to invite one of the hospital's largest donors, Mrs. Smith, to be vaccinated. When Jasmine comments that the clinic is for current in-hospital volunteers, the VP says, Mrs. Smith has dedicated lots of time to causes on behalf of the hospital before, and the hospital cannot afford to disappoint her. I already have like the knot in my stomach because this has happened to me. Jasmine knows Mrs. Smith doesn't meet the current age requirement for vaccination and is unsure of her medical background. So what does Jasmine do? So she's got her coworker here. She's got her job that she needs to do. She's got her volunteers that she needs to focus on. Now she has a coworker that's coming to her kind of saying, I need you to give some preferential treatment to this donor. What is she supposed to do? So let me walk you through those steps. The first thing is she's going to gather information. Who is ultimately responsible for the distribution of vaccines at the hospital? Are there clear guidelines for distribution? She's going to find out all this information. The other thing she wants to find out about is, has the VP discussed this request with anybody else, right? Because there's implications for that. Is there going to be a second and a third and a fourth donor? Is the board chair's wife going to want a vaccination next, or someone else's children? Like, what are the implications of that going to be? What happens if you prioritize someone based on something other than the established criteria? So as far as Jasmine knows, being a donor to the hospital is not part of the criteria. And then who are the stakeholders? There's the hospital, the CEO, the board of directors, the volunteer, the community, and then there's Jasmine, right, as herself and what she is prepared to do. Next, you're going to identify the conflict. So in this ethical dilemma, the core values at the heart of this dilemma are fairness and the principles of equity and justice. So the equity of access to the vaccine. There's the idea of the value of trust, and the principle of integrity comes to play, and possibly the idea of accountability and professionalism. So if Jasmine was to fulfill the request that Mrs. Smith gets vaccinated, what is the domino effect on all of her other colleagues in the hospital and healthcare sector? So the main conflict is that Jasmine is being asked to give preferential treatment to someone based on their financial contributions and not their eligibility. So in doing this, she's going to inconsistently apply the rules. So then she's going to think about, like, what are all the different options and outcomes? So one is inviting Mrs. Smith to the vaccination clinic. Maybe she'll give a large donation to the hospital afterwards. The second one, she could invite Mrs. Smith to the vaccination clinic. Mrs. Smith could tell all her friends, and now all of a sudden the word spreads and Jasmine has to deal with that. The third one is, Jasmine asks Mrs. Smith if she meets the current criteria, and when she says yes, okay, great. So she does meet the current criteria, then I can include her. 4, Jasmine declines to invite Mrs. Smith. She does not, because she doesn't meet the criteria, and she makes the VP of development angry with her and faces the fallout of that. And lastly, Jasmine declines to invite Mrs. Smith, but the VP invites her anyway. And, it's not Jasmine's decision in the end. It becomes the decision of the VP. And then Jasmine can leave that up to them, right? So if it is something that, blows up in the media and whatnot, it's something that she's been really clear about. She declined it. She didn't give that preferential treatment, and the organization would have to deal with it differently. So what Jasmine would need to do then is to decide and test. She can use the click method, thinking about the consequences, the legalities, all of those different things to help her decide. And then step 5, whatever Jasmine decides. And I say this to you because I have so much confidence in our profession. I have so much confidence in you as a leader of volunteers. You've got these amazing tools to help you. Whatever you decide, you act with confidence, you act with courage, and you act with professionalism. If you're questioned about your decision, you've got your worksheet, you've got your decision making process. You can justify your actions, you can justify why you made the decisions that you made. You can also even talk about where you pulled in other people in your organization for help and for support. So I want to end off with just a quote that really sticks with me, because I think that as leaders of volunteers, we're so intimately tied to our communities. We invite our communities every day to help us in achieving our missions, which are really for them, right? We don't exist without community. And we are in a unique position in our organization to really understand people and their motivations. And that's part of the volunteer cycle, is understanding why volunteers are motivated, recognizing them and evaluating them appropriately. So this idea of moral courage is something that really sticks with me. It's also something that I have found has really carried me throughout the pandemic, throughout the racial reckoning that our country is undergoing at the moment as well. For my colleagues that are working in disaster relief, this is something that for them and the volunteers that they partner with, that's also really important. And moral courage is the quality of mind and spirit that enables one to face up to ethical dilemmas and moral wrongdoings firmly and confidently, without flinching and retreating. And so when you're ready and you've gone through this ethical decision making, and you're at that last step where you have to act with courage and with professionalism and confidence. You know, a lot of that is not something that a policy is going to help you with, or it's something that's going to it has to come from within. And so this is what really being ethical is about. And being ethical oftentimes requires courage. And it doesn't usually say on our job descriptions that courage is something that is involved. It's hard work for sure. It can help us want to retreat. It can help us want to flinch, you know, as the quote says. But learning the skill of ethical decision making and learning that process of going through those steps, getting really comfortable with the click method, it really will give you the confidence you need and that moral courage to navigate the dilemmas that you're going to encounter in your daily work. And I say all of this because in the end, you know, in doing this, it really is what makes our communities and what is going to make Florida a really beautiful, wonderful, safe place for all communities to live. So how do you exercise your ethics? Just as we are closing off, oh, I think one of my slides is out of place here. Post the CCVA values and principles near your desk. Talk about ethics at staff and volunteer orientations. It's a great place to share the values and the principles of our profession. A lot of people don't even know we have ethics in our profession, and many of our colleagues do for their profession. So it's a really great common place, a common ground for us to talk about our commitment to the work that we're doing. You can use scenarios as discussion starters. I have many. If you are looking for scenarios, you can email me and I can send you some. I can help you build some as well. Practice the decision-making process as a team so that, you know, when you come into contact with an ethical dilemma, you know, you've exercised that muscle and you know how to do that together. You might want to devote time at staff or board meetings to focus on an ethical principle. It's also a great way to profile the professional ethics, right? So at a board meeting or at a staff meeting, hey, we're going to talk about these ethics and go through a case study. And it really will help your colleagues to understand the complexities of the work that you do. You're not just the person that plans the volunteer parties. You're not just the person that is nice all day long. It's hard work. And one thing that's really important is find colleagues, whether it's community members, whether it's people in your social circle, whether it's people that you're meeting through Volunteer Florida, myself, I'm here for you. Find colleagues to serve as your sounding board. All right, so you've got this. We have covered today the body of knowledge and competencies. You've got a self-assessment to spend some time with to see your ones and your twos and your threes. You have the professional ethics in volunteer administration. You also have the decision-making tree, and you've got me, you've got my email address, our website with resources, and I am here to help you navigate these tools and help you to realize your full potential as a leader of volunteers. We have so much room to grow and so much learning that we can always do. It has been a real pleasure. And Jovita, I will turn it over to you.
Hi, everyone. Thank you so much for participating. I am going to send you a survey and all of the resources that we had available today through Cva. Cva, thank you so much for this extraordinary information. We appreciate you so much. And all of you who participated, thank you for being here today. We value you so much here at Volunteer Florida and the tremendous work that you do. So you all have a wonderful week. This was a great way to start it off. And take care over on the West Coast, Cva.
Thanks, everyone.